Okay, good morning, everybody. Welcome back to our Happy Hearing podcast. This is the first one for 2024, and we have a really interesting, exciting guest with us today. I'm going to first reintroduce my co-host, Carly Sygrove, and she's going to, and then we'll introduce our guests and take it from there.
Okay, hi everyone, and Happy New Year. It's great to be back for episode 7 of the Happy Hearing podcast. I'm Carly, I'm a hearing loss coach and an advocate and a writer.
Thank you, Carly. So today we have with us Dr. Elena Kagan-Weitz. So she is not only a good long-term friend of mine and colleague, but she is also a fellow professor at one of our local universities here in New Jersey. So I want Elena to kind of introduce herself, and then we're going to chat about the future of audiology, education in audiology. We'll brush on topics like artificial intelligence in education, and just some of the new hot topics within audiology in general.
Okay.
Welcome,
Hi,
Elena.
everybody. Hi, thank you. Thank you, Dr. Reisman. My name is Dr. Elena Kagan-Weitz. I've been an audiologist now for, I would say now 13, coming on 13 years. And I have been a preceptor and adjunct professor at Montclair State University now since 2017. So thank you for having me, guys.
Of course. Welcome.
Welcome.
So I guess the first question that I have, since I'm also kind of in the university setting, I just want to get your take on, the new generation of upcoming audiologists, how you find the preceptorship, I guess, evolving over time, and what do you think these new professionals that are coming into the field are going to add to our profession?
So that's a really great question. Well, first of all, I love working with students because there are so many different students, different learning styles, and then, they become all sorts of different professionals that add to our field. With the current student body, I find that we get a lot of students that are coming from very diverse backgrounds. I have found that we have now an increasing number of second career students, students that have been in different fields, very diverse fields, students that are coming from different fields in healthcare that have business backgrounds, marketing backgrounds, and they're, seeking out audiology as their kind of their second career. And with an increasing number of those students, I find it adds so much value to the profession because they're able to look at things in audiology from a much different standpoint versus students that are coming with a communication sciences background. And I have found that in students coming in as second career students, they will usually also be kind of more mature and have a different understanding of education as well. I find that that really adds to it. And also with students, just students overall, I find now with just increases in technology, we're able to precept students better. I remember, when we were students, Dr. Reisman and I were students together, we didn't have a lot of the technology that we have today. We didn't have Zoom. We didn't have so much simulation and education that we can use now as resources to further learning and clinical expertise.
Yeah, I also think that that's something that I've noted in the field that, that traditional trajectory of going from a communication sciences background and then either moving on to speech language pathology or audiology is not the norm or is not the standard. We are getting students with different backgrounds. And I find that really interesting that I always ask when students come from a career that they have established and they've spent so much time establishing their career, and then they come back to school and are okay starting all over again. To me, that's a very scary thing. I think they're really brave. But I'm always curious as to why they got there or how they got there. And the story is always interesting. And like you said, it just brings another dynamic to to the field and a different perspective from the original perspective.
Exactly. And I could also add to that, that I also always ask students, what is their background? How did you get into audiology? What made you apply here? And I think a lot of the answers that I get are actually due to, the people's altruism, or, they want fulfillment from helping others. And sometimes in certain careers, people who are, intrinsically motivated to help others, people who have a really altruistic nature, they may be unfulfilled in, a successful career. We have had a lot of individuals leave, very successful careers that were high earners, that are, pursuing audiology because they're, number one, lifelong learners. They love to learn consistently, which is, what an audiologist always does. We learn every day until the end of our careers, sometimes even past that. And then, they find it so, just so rewarding to help others, to hear better, to communicate, which is, one of the biggest, kind of health crises that is occurring, within the worldwide population. And I find a lot of the students will come to me and say, hey, I had this great career, but I just want to help people. I find that the most rewarding thing. I want to spend time helping people to hear, to communicate, and to be, really kind of part of the world and engage.
Yeah. I think, Carly, you had that kind of career shift in a way, although you went from helping kids to helping more people. But
Yes.
what did you feel? How did you feel about that? Was that a scary thing? I know some of it was due to your hearing loss, but what's your perspective on that?
It's quite interesting because what you're saying, Dr. Weitz, is I hadn't even thought about it. I thought, oh, I thought it's just probably just been their path. They've decided to be an audiologist, or I hadn't thought, oh, maybe people be retraining. And it's exactly what I've done. The reason I was a teacher for about 14 years. So I was teaching very little children, so early years children, 3 and 4 year olds. And I taught in different countries all around the world. And it was amazing. And I'd recommend it to anybody. I stopped the career. Firstly, because I developed vestibular issues, so balance issues. So a lot of the triggers were in the classroom. But then part of me was also at the point of thinking, I'd already started thinking outside of teaching before I had my hearing loss. So I was almost at that, I was ready to look for something else. And I didn't know what to do. I had no idea what I was going to do. And actually, somebody I helped with their hearing loss turned out to be a therapist. And she sent me an email one day just saying, I know you're looking for work. Have you ever thought about therapy or coaching or anything like this? And I kind of had, but just hearing it from somebody else, kind of saying, oh, maybe you could look into this, was actually really encouraging. And yeah, that was kind of the start of my new story and the start of my new career, which, yeah, I'm really enjoying at the moment. So yeah, I can see how people would go from one similar, like if they're already in a caring profession, to something like audiology, but all the same as well, like if they're in a profession that's not fulfilling that part of them, to then actually go into it later in life. So I can understand those people who are doing this, see the benefit in doing that as well. And not only do they bring that care that they have and that want to help people, but they bring all those other skills that they've learned in their past careers, in their past lives. And I mean, that just creates so much more diversity in the field and brings so much, so much knowledge as well and experience.
Yeah, thank you, Carly. Thank you for sharing. Also, I like that you took on the role of, a hearing loss coach, because I feel that oftentimes in the audiology profession, because we are healthcare professionals who are, our scope of practice is to diagnose patients and rehabilitate their hearing loss, rehabilitate their vestibular issues. We sometimes not miss, but just don't really have enough time for, the humanistic or the emotional component of hearing loss or vestibular problems. And I feel what you do really adds to the field, because oftentimes as you're diagnosing patients or rehabilitating patients, you may not look at it from a humanistic perspective. And I find that that is a really vital component of, treatment of hearing loss and balance issues in all patients. So I think what you're doing is really great.
Thank you. I think, yeah, exactly what you've just said there is my reason for going into this as well. It's not just for me. For me, I tried a cross hearing aid originally. So the hearing aid that could send the sound from one side, from my hearing side to my deaf side. And it didn't work for me. And I was told at the time that was my only option. More recently, I'm looking into a cochlear implant. I will be getting one this year, hopefully. That's a whole new story. But yeah, I was told at that point, okay, by my audiologist, she'd really wanted to help. She tried, and she's like, there's nothing else we can do at this point. And at that point, I was like, I kind of walked out the door of the audiology department and thought, what am I supposed to do now? It kind of gave me that hope. Oh, maybe this can help. Maybe this can help or change the way I'm hearing. And then when I realized this is it, I'm going to have to learn how to live with single-sided deafness, not only the practical impact that that brought, so difficulty hearing in background noise, which can lead to lots of difficulties, for example, in learning environments, socializing, all these things, but that emotional impact that came with it as well. So the impact of suddenly losing hearing, the impact of feeling less confident in myself, especially when I was outside and not knowing where sounds were coming from. All of this was happening and I was on my own. And, I look back on that and think, that it was actually really difficult. So with reflection, it was really difficult. And since then, I wrote a blog. I've connected with lots of people. I have a support group online, and I wasn't the only one, dealing with this. Everybody who was contacting me was dealing with this kind of this gap in their journey where they found they couldn't really find support. They didn't really know where to look for support, and they needed some help just moving forward to live their life with hearing loss. So that is why I got into this originally, just because there seemed to be a bit of a gap there.
For sure. And I think that's what, I enjoyed most about meeting Carly. And I think, bringing it back to the students, often in the university setting, we're so focused on the diagnostic part. And as much as we know, we are also, and actually started as a rehabilitative field, I feel like there's a lot lacking in that arena. And how do we really increase the awareness amongst, emerging audiologists, and what are we doing as part of the university to make sure that we're tapping into all of those things, and not obviously the evidence-based practice and knowing the diagnostic portion and being really efficient at it and effective at it is important. But what about the humanistic part and the rehabilitative part? Elena, can you speak to that in terms of the university?
Sure. And just to go into what, our university and our faculty is doing, as inclusive of myself, over the past few years, we have really looked at that in our program and in our curriculum. And the student need to really understand the emotional component of hearing impairment and vestibular deficiencies. And we have added classes and seminars and any kind of continuing education to students to focus on that. So for example, in the past few years, we've added a really comprehensive counseling course where we really focus on treating patients as individuals, where we talk to students about not just really looking at the patient's chart and saying, okay, this is how I'm going to treat the patient, but looking at, psychosocial factors, cognitive issues, things where we treat the patient holistically and we just don't treat their impairment. And I feel that that is important, not just in audiology, but across, all healthcare professions. Because when we treat patients just everywhere, you're not just treating the patient on paper. You're not just treating the patients, as part of like a data point or a percentage of, a disorder that you're seeing, but you're really, looking at the patient as a whole, because, that's really kind of where the variability in the treatment and how you even, speak to the patient or engage with a patient, that's where that comes in.
Yeah. I mean, I'm personally really excited that we're sending out more and more audiologists and professionals, understanding that component to it. What I find that's lacking in the field in general is that there are active clinicians that don't realize that. And I think that there's a huge gap sometimes in making the appropriate referral to offer, and like Carly experienced, like, well, there's nothing else that we can do. But is that really true, right? Did anyone ever offer you, hearing rehab or hearing therapy, or like you said, the cognitive behavioral therapy or the counseling portion of it, or even just the emotional, like, why wasn't that offered? And I always find that interesting because sometimes I see patients that don't come to me until about 8 or 12 years later, when they have initially told their physician, I have hearing concerns, it's difficult for me to live my day-to-day life, to communicate with others, and they didn't make the referral. And it
Yeah.
just boggles my mind sometimes.
What I find with the students that I see now, and more so I could speak to kind of the next generation of audiologists, is that the younger generation does have sometimes a little bit more awareness of how mental health fits into healthcare and our overall well-being as a whole, that individuals who have been in this field for several decades just may not have. And I do find that with just greater awareness, just generationally and overall now with, the advent of, social media and just a greater awareness of just mental well-being as a whole, I find that that could positively contribute with new students now, because they do understand the need to treat a patient holistically. I do think what's necessary is really to provide, like you said, Ruth, to provide patients with, just more referrals, and to work, collaboratively, and to have more interprofessional contacts, where if you know that a patient has, psychosocial effects from hearing loss, that you could possibly refer to, a mental health counselor or somebody who does coaching, and provide them with resources that go beyond, even our standard audiological rehabilitation. I know in patients who have tinnitus, and I have spent, the past few years treating more and more tinnitus patients. If necessary, I do provide a referral for, behavioral health for a specialist, because I know that that is a very big component of, tinnitus treatment.
Yeah. And I guess one other aspect you spoke about, so diversity, right? Which is also another layer to treating patients holistically, that people come from diverse backgrounds, not only educationally and professionally, but culturally as well. And the role that that plays in audiology. I know there's a big emphasis on that in the university, in increasing students' awareness about different cultures, different backgrounds, and their perception of healthcare. What what is your university? Because I'm curious about this and ways that we can enhance it with the students, doing to kind of integrate that aspect as well, looking at the cultural aspect and people's perception of healthcare in general.
Thank you. That's a great question. So we do provide coursework in kind of the cultural aspects of audiology. And also just with different preceptors or supervisors throughout all of their clinical rotations. There is, in our grading rubric, it does support, looking at how the student has handled themselves in, let's say, a culturally appropriate or socially appropriate fashion with different patients. I know myself, I do go over several things with my students regarding just acknowledging patients' different backgrounds, again, different generations, even different literacy levels that can play into, the need for kind of modifying your patient care.
Yeah, that's a great aspect for them to, I think, also develop and realize that that's a component of treating the patient holistically in general.
Mm-hmm.
Carly, what do you think about that coming from? I know that audiology, it just seems like so interesting because audiology is so different, even across in different parts of the world, I feel like. What is your perception of that based on the clinical care that you've received in the different countries?
I think you find similarities I have with people from many parts of the world in the way that, well, in the protocols, in the treatment we accessed. For example, I connect with a lot of people who have had sudden hearing loss, and often the treatment protocol is the same. It's the corticosteroids, but there are certain differences. Like I received intravenous corticosteroids, for example. Other people have received just in pill form. So there's different protocols like that in terms of like the more medical side of things. But then in terms of the way the access and the experience we've had with audiologists and that side of things, they do vary quite a lot. Um, and I think here for me, my experience with my audiologist, I knew she wanted to help. She was great. But at the same time, like you said, there was no referral. It was just, okay, this is the end of, our time together. I had to go private because for a cross hearing aid, we couldn't get that on healthcare system here. In the UK, for example, people are seeing audiologists for cross hearing aids on the healthcare system. So there are different experiences, but then they're often finding they're not given enough time with those specialists because they may be working in a hospital rather than a private clinic. So there are different experiences in terms of cultural diversity and sensitivity. Of course, it's important, and I think I see that as just treating people as a whole, holistically. Just, I think whenever you're in a job or role, you get used to that role, whatever it is. So when I was teaching, I'll be so used to, okay, new children coming in, talking to new parents, talking to new teachers. I was used to it. And I think sometimes there were things I didn't notice, or there are things that I forgot, or things that I didn't recognize because I was just so used to that role. And I think for anyone in any role, but for this conversation, audiologists, just remember that this is a person coming through your office. Maybe they're suffering from lack of confidence. Maybe they're really upset. Maybe they're grieving the lost hearing. And they're not just there for a hearing aid or a hearing test. Maybe they're there as well for a chat, just to kind of let some of those feelings out. And even just a patient feeling like they've been heard, even if you can just listen to them, that little bit of time you can give them, that extra time, can mean so much to people, just to know that what they're feeling is okay and is normal, and that they've actually been listened to and understood. And I think that's a huge part of anyone working with people with hearing loss, is just to actually listen to what people are going through and how they're feeling and their difficulties and their triumphs as well, so when they do have positives and they do start moving forward, listening to those as well.
Yeah, that's really interesting. It just reminds me of a patient that I just spoke with recently. Like you said, when you're there to listen and just allow them to process whatever is happening and process their feelings, it may not necessarily be in that moment that they're going to be ready to pursue hearing therapy or pursue a hearing aid or a cochlear implant, but they knew that you cared. You gave them the information that they needed to make an educated, well-informed decision based on all of their options. And knowing that they may show up later on in life or later at a later time and say, remember when we spoke about this, and I'm ready now to get the help. And I just had a patient like that recently who said that. And I remember just saying, well, we're here to help. I know if you're not ready, that's fine. If you need me, you could always ask any questions that you want. And then out of the blue, she just said, I'm ready to do the therapy. Can we move forward?
Wow. Because she established that connection previously and she felt that trust.
Yeah. And I think that's the part that we need to now give over to the students also, in terms of focusing on treating the patient holistically, and then from the emotional, rehabilitative, mental health side of things too.
Exactly. And with this current, generation or student body of future, doctors of audiology, in our university, we always focus on that. We always focus on what we consistently say is we're treating the patient, not treating the audiogram. We're really kind of looking at the patient as a whole. And I really stress with my students that a lot of times people just come through your door because they want you just to acknowledge that you have a problem, that they have a problem, and to really just have you say, hey, there is a solution to your problem. Regardless of whether they're going to want to pursue that solution or not. Whenever people come through our door as audiologists, they just want to know, hey, is this person going to, encourage me and understand me and kind of be there as, a competent healthcare professional, be there as somebody that I could have a dialogue with. And I stress that with my students as well. I always say, counseling and speaking with patients is really a dialogue and not a monologue. You're there to really be a source of help for the patient, somebody that somebody can turn to. And I do find that in this current student body that a lot of students understand that a lot of students embody that all of our students have that kind of empathetic nature, that every student that applies to an AUD program that is willing to put 4 years of education under their belt, that they're there for the right reasons, that they're there, with that altruism to really help patients, to understand them, and to have patients communicate better. That's the ultimate goal.
Yeah. And what I love about this conversation, and looking into the future, one of the topics that I really wanted to discuss as the pinnacle of this conversation, which is interesting because technology is advancing so quickly, right? And there's so much that's coming about with over-the-counter hearing devices. And then we talk about artificial intelligence, even in the diagnostic portion of audiology. And there's a lot of fear surrounding that in general in our field, that, that potentially can replace the professional or the audiologist, the counselor, the coach. And, I debate this in my head often, but if we listen to what we're actually talking about right now, in how helpful or how important it is to add that humanistic portion and that human part to healthcare and to audiology, it always reminds me that I think it's impossible to replace that aspect, and that there is this natural need for individuals to connect. But I think it is important to talk about, the future and look at the technology and how it could potentially impact our field in general, and the way that we care for patients and the way that we practice, and looking towards the future for the audiologists that are coming into the field that are a lot more savvy about these things. So Elena, Dr. Weitz, do you have any input on that, and how that technology and artificial intelligence could influence our field?
So I actually have a lot of input on that because it is, a current issue that I feel a lot of professions are struggling with, including our own. It is really at the forefront of our field in the university setting, as well as I feel with clinical practitioners, as well as in audiology industries. What I always say is that technology advances, at the speed of light. We're always getting new technology. And when technology is here, it's here to stay. There's no way to get rid of it. And I feel that with every technological advance, there's always something that occurs that's a little bit fear-based in a profession. Like whenever I remember when hearing aids started to connect with phones, everybody was like, oh no, hearing aids have Bluetooth, a lot of people were very trepidatious of that, or rechargeable batteries, or with the advent of telehealth. And there's always some trepidation with that, but it's here to stay. And I believe that all the technology that we have is there not to replace us, because we cannot replace the human component of audiology. And that is at the forefront of our profession. We cannot replace that human component, but I believe that the technology out there can really be used to aid us as professionals, and can be used to be used to train students in the university setting. I think that it should be perceived as something that we could use to help us, and not something that would interfere or replace us in our profession. I do think that with the advent of new technologies, we could provide students with greater educational opportunities that are, simulation based. That's been really something that has added to us in our university training of students. And I think that things like artificial intelligence in the future, once more developed, it will be used to, again, help students in their training in some ways. I don't have great knowledge of what's to come, and there's very little out there currently with training students regarding artificial intelligence, but I believe that it has great benefits for the future. And in regards to the audiology profession and clinical practice, I think that we can in the future use artificial intelligence in, let's say, helping patients with hearing loss, helping them through that emotional component, helping us in counseling patients, helping with greater adoption of hearing aids. I don't think that we as a profession should fear technology. I think that we should welcome it. I think we should welcome all the advents to our world as a whole, and as a profession, we should really be adapting to it. And my hope is for the new body of students who are typically a little bit, on the younger side and are more familiar with technology. They're the generation that really grew up only with, technology, who grew up only with the interface of, iPads and computers and cell phones. I hope that they will have such a greater comfort with it and be able to adapt it into their day-to-day clinical practice.
Yeah, I think that's a great way to kind of tie everything together. Like you said, looking at technology, looking at the future, adding that humanistic component. And I think we should all be hopeful that the field is really going to advance and move forward, and just provide more support and assistance to those who need it. And like Carly said, fill in those gaps. And I think it's up to us to really think outside of the box and work towards filling those gaps, increasing awareness, and supporting our patients in the way that they need to be supported.
I think the hope with better technology will be not only better hearing, but better overall well-being as well.
For sure.
I agree with that. I find that with greater advances to technology, such as the ability to, practice telehealth with patients, or the ability, in the past few years, the ability for me to just, have a patient sitting in their home and being able to modify their hearing aids has added such a great component to the ability to care for patients and to individualize patient care. Because, when we were talking about looking at the patient, holistically and treating our patients, not all patients have access to transportation. Not all patients are able to ambulate so that they're able to see their audiologist. So I find that with greater technology advances, we're able to help patients more. Thus, I feel that just adoption of it by the new generation of audiologists is really gonna put the field in a new light. And I hope that it will be used to really support our patients and their, uh, hearing healthcare. I hope that it will help us in training patients to communicate better as well. I feel that there is a lot in the frontier of this profession. And I'm very, very hopeful that all the students that are currently, training or that have just stepped out into the field, that they will use this technology and be really innovative with it.
Yes. Well, thank you so much, Dr. Kagan-Weitz, for coming and being with us today. I really enjoyed the conversation. I really always appreciated your perspective on things and the way that you work with students and in general, your devotion to the field. So thank you so much for joining us. And we hope that we continue to see great things from all of the students and in general from the field in general.
Thank you, Dr. Weitz. It's really good to meet you and exciting to, to see what's going to happen next in audiology.
And thank you both for having me. This was a great conversation, and I really enjoyed speaking to you guys. Thank you.
Of course. Have a great day and
worries.
Happy New Year to everyone here
Happy
and
New
to those
Year.
listening as well.
Okay,
All the
Happy
best.
New Year, everyone.
Thank you.
Bye. Have a great day.
Bye.
Bye.